We talked about the vaginal health.
Mm.
And you said saliva carry bacteria.
Yes.
And now the question is oral sex healthy?
It's enjoyable. But what we usually advise is, you know the mouth.
Mm-hmm.
This is now the science. There's the science and there's the social part of it, the enjoyment part of it.
Mm-hmm.
Now the science is, the mouth, the way the vagina has its normal flora, normal bacteria for the vagina. The mouth also has its bacteria and everything.
Good morning, good afternoon, good evening, depending on where and when you're watching us from. Kwa wale ambao wametujoin leo, karibuni sana. And for our followers, we are grateful. It's your host, Lea Ngure. And with me, kama kawaida, tuko na bwana daktari from Modern Gyno. Karibu sana, daktari.
Thank you so much, Lea. I'm happy to be here and to answer to the questions from kutoka fans. Dr. Karanja, consultant obstetrician and gynecologist. Karibuni sana.
Nice. How have you been?
I've been well.
You've been well?
Yes,
You're
I've been treating patients. Yes.
Hujaenda mgomo.
Sijenda mgomo.
And we thank God for that.
Yes.
Maswali yako. Ready.
Yes.
I know you're ready for us.
I'm ready.
What is epidural during delivery and side effects zake?
Now, epidural is, you see, during labor, there's a lot of pain. So when you're given epidural, it's a drug which is injected into at the back, just to numb the pain and also to numb the lower part, so that yes, you have labor, but you don't feel pain during labor. Basically, that's what epidural is. So the reason why we do epidural is to reduce and many times knock off pain completely. So you might find there are women who want to deliver vaginal, which is what some people call normal, but they don't want to feel pain because sometimes pain can cause a lot of trauma. So we use epidural to remove the pain, so you don't perceive pain during labor. So you'll have labor, you'll have contractions, you will progress from 0 until when the cervix is 10 centimeter. When you're pushing, the baby comes out, but you don't feel any pain. That is what we call epidural anesthesia. And when you get now the epidural, you might have better experience because you wanted to deliver normal. And we have women who, because of the pain, they don't want to try deliver through the normal delivery, what we call the normal delivery. So to prevent that and to prevent doing many CSs because of the pain, we sometimes do what we call epidural anesthesia. So you have labor, but no pain. Mpata mama ako in labor lakini muna smile. Muna smile.
Yes, that's a good one.
Now, in terms of you asked about the side effects.
Yes.
Because we have pros and cons. Now, the pros is the mother does not have pain and the labor is smooth. Now, some of the cons, the disadvantages is, if you compare epidural and just normal labor with pain, epidural sometimes is a bit prolonged. So your labor will be longer. And sometimes the reason could be, you see, when you're almost pushing the baby, usually when you get pain, you have that urge to push because the pain will make you have the urge to push. Now, when you have epidural, yes, you're supposed to push, but we have to sometimes to remind you, tell you, please push so that the baby can come out. So that urge to push is not as someone who experiencing pain. So that part of pushing sometimes can be prolonged. Yes. But so long as the baby is okay, it's normal to have a prolonged period of pushing when you have the epidural. Now, the other maybe disadvantage is your monitoring is very close. You need very close monitoring, meaning you have one nurse and one woman in labor, so that you don't have one nurse who is monitoring 3 women. All of them have epidural, and you have one nurse in the labor ward. So you should have one nurse and one woman in labor, because we want to check your blood pressure, we want to check your pulse, we want to monitor the baby's heartbeat more frequently, and sometimes you might have to monitor it continuously. When I say continuous is, there's a gadget that can be put in your abdomen, and it measures the baby's heartbeat throughout, because sometimes the heartbeat can either go high or very low, or it can be irregular. Irregular means right now the heartbeat is 120. After a few seconds, it's 160, then comes back to 120. So we have to monitor that very closely. So the monitoring is very close as compared to someone who is not having an epidural. Yes.
Wow, that's interesting. Another question,
Yes.
What supplements are recommended after childbirth?
Now, after childbirth, we prefer natural things. Okay? If you're having a normal balanced diet, in any illness, in any part of pregnancy, before pregnancy, after pregnancy, just have a normal balanced diet. But of course, pregnancy and childbirth comes with hormonal changes, and sometimes you have cravings, you don't want to eat this. So there are those supplements that we recommend you might have to take longer. Calcium supplements are important, and calcium supplements usually come with vitamin D most of the time. It's also recommended you can continue with your iron supplements after delivery, and more so if your blood level was low. And some women, when they deliver, because of the blood loss, so whatever blood is remaining is a little bit lower. So they have to take the iron supplements for longer. But if you're having a balanced diet, you're okay. It's not a must to take supplements. It's not a must.
Okay.
Yes.
And when is folic supplement, the folic one?
Yeah, the folic. Yes. Now, folic is, we don't necessarily advise it after delivery, but folic should be taken before you get pregnant. Any woman, we assume, in an ideal world, you should plan to get pregnant. But of course, we are not in an ideal world. Most women, even those who are married and they have planned maybe to have 2-3 children, sometimes you just find you're pregnant. But we usually say plan when you want to get pregnant. So if, say, you're using a contraceptive and you stop it a month or 2 before your intended time to get pregnant, you need to start on folic. Folic is the most important supplement before and during pregnancy. Now, when the use of folic is when you get pregnant, during that period, the first trimester and the first few weeks, that is when the cells are dividing. You see, when you have fertilization, one cell, the sperm, one cell, the ova. When they come together, for it to form a baby, the cells have to divide. And they divide quite frequently, very fast during the first trimester. And most of the organs are formed at that time. So folic helps in that process. And it helps prevent some congenital problems, like necessarily in the brain. So it's very protective for the brain when you use folic acid. And we don't want you to start using it when you get pregnant. Because by the time you know you're pregnant. Okay? So you want you to use before you get pregnant. Because when implantation happens, cell already have started dividing. So you need to have folic in your system before you get pregnant. That's why we advise folic acid. And you continue during pregnancy. After pregnancy, folic acid you can stop. Yes.
Okay.
But iron can be continued after pregnancy if your blood level was low.
Okay, that's good. And most women struggle with weight.
Yes.
After birth.
After birth. And during pregnancy.
And during pregnancy.
Now, we get many women who come to the clinic. They're in the second trimester, third trimester, and they tell you, hey, doc, bana, hey, you weight, maze. Am I okay? And you look at the weight, you plot it on the graph. There's a graph we use. We see the weight increase is normal. There's what we call abnormal, and there's what we call on the lower side, and there's the normal. Most of the time, it's normal. After delivery, because that is a question that you've asked, most women shed off most of the weight. Okay? So if you increased your weight by 10 kgs, the first few months you'll shed off. But some women, their weight increase or the baby fat persists. Now, it's mainly because of the hormonal changes and whatever had happened during pregnancy. But also, we know our society. What happens after delivery? You eat.
Eat well.
In Kikuyu,
you must produce.
In the Kikuyu community, you unapewa chakula sawa. Unapewa njahe, uji, chai. Kazi ya mama ni kunyonyesha, na kulala, na kupumzika. So sometimes that is what contributes to increase in weight. But if you take balanced diet, you're okay. So long as the milk is already enough for the baby, you can take normal balanced diet. And of course, exercise.
How will you know that the milk is enough?
Milk enough. The baby is, once you breastfeed the baby sleeps. They don't cry all the time.
Oh,
yes.
So one sign you have good milk and enough milk ni
yes, the
anatosheka.
Baby. Anatosheka.
Analala.
Unamweka kwa matiti, ananyonya, analala. But if your baby keeps on crying, the baby is breastfeeding after 2 minutes, the baby is not okay, baby is crying, the breasts are dry, then it means the milk is not enough. But if the baby sucks and sleeps, that milk is enough.
Wow.
You don't need a container to measure to measure the amount of milk.
Still on weight and breastfeeding.
Yes.
There's this challenge that comes with breastfeeding. You find your nipples cracking. Then there's that extra pain that you feel. That way you don't want to breastfeed anymore.
Yes.
How should a woman take care of that?
Now, that commonly happens with it's very common with first-time mothers. Because this is, the baby is breastfeeding and milk is little. The first 1 or 2 days, sometimes there's not even enough milk. And this person is angry. So they keep on sucking and sucking. So you're sucking something that is dry. So there's that soreness that happens. So you get a lot of pain when you're breastfeeding. And some mothers end up avoiding to breastfeed the baby. So they use the NAN. So some of the measures you can take is you can use what you call cold compression or warm compressions. Just take a soft towel, dip it in something cold or warm water. Then you do compressions of the breast. That might help. If you get an infection, then that has to be treated. So if it worsens, you need to visit your doctor. They examine the breast if there's any abnormality, and you'll be treated. But you also need somebody to train you on how to breastfeed. The way you position the baby, how often do you breastfeed, how do you change between the two breasts. And this needs to be done during pregnancy. Yes. So that it's not like an ambush. Because once you deliver, within the first 1 hour, you expect that baby to. So there's no time to train you after delivery. So it should start before delivery.
Wow.
Yes.
First time moms, we are here for you. Hamtapitia ile vitu watu walipitia.
Yes.
So we are here for you. Wow. Okay. What is the best contraceptive? Hormonal or non-hormonal?
What is the best contraceptive?
Yes.
I would say there's no best contraceptive.
Uh-huh.
The best contraceptive is to abstain. If you don't want to get pregnant, abstain. But let me clarify that. There's no one magic contraceptive or family planning for all the women. No. There's the contraceptive for Leah. There's one for Faith. There's one for, I almost said Karanja. There's one for Anne. So there's no one magic, and you say this is the best contraceptive
for all women.
For these women. No, you have to customize it to each individual. So it depends with the age. It depends with your intentions. By that I mean, do you want to wait for 6 months before you conceive? Do you want to wait for 5 years? Do you want to stop completely? Maybe you have your desired family size and you don't want to conceive in future. So the best is for that individual. We will discuss with you. We'll discuss the side effects. We'll discuss many things. So we'll try and find one that is best for you.
Wow.
Yes.
Wow, that's nice. Another question now. What do dates have that stimulate labor?
Let me just go back now to the hormonal and the non-hormonal.
Yeah.
The most important thing to understand is how effective is that contraceptive when you use it the right way. Number 2 is the side effects. So if you're using hormonal contraceptive, some of the most common side effects is increase in weight and sometimes even decrease in weight. So some women, the weight will increase, some the weight will decrease. And we don't have a tool to measure that wewe yako, weight yako itapungua na ya huyu itaongezeka. So it's like try and error. Use it. If you get weight increase and you're concerned, we stop. The other common side effect is irregularity in your periods. So it might give you irregular periods. And sometimes it can even give you prolonged bleeding. So we manage each side effect as it comes because it's unpredictable. Yes.
That's good. The one that I've asked about dates, what does it contain that stimulates labor?
Dates during the before labor. Yeah?
Yes.
There are many things that people use that will stimulate labor. Sometimes we don't advise. If possible, wait for normal, natural, spontaneous labor to come. Because the more natural the labor, it means the baby is ready for that delivery. The mother is ready for that delivery. The muscles are well prepared for that delivery. Because labor is a process. The head has to position itself in the right position so that it can come down, compress on the muscles. There's that pressure on the muscles and the baby comes out. So if you want to fasten that labor by taking other things, you might actually, the head might not apply well and the muscles might not be well prepared. So we usually don't advise you to take stuff to bring labor. But back to the question, we have dates, we have castor oil. Some people say pineapples also induce labor. The dilemma usually is, what dose are you using? Are you going to take 10 dates so that labor can come? Castor oil, are you going to use a tablespoon or are you going to take the whole Is it going to be 3 times a day or 4 times a day? So that is the dilemma that we usually have. Even when you ask us, how much of castor oil should I use? I don't know the dose. So we usually don't advise because we don't know the ingredients that will stimulate labor in whatever you want to use.
Wow.
Yes. But there's that worry that comes when you reach 40 weeks. It's your expected date of delivery. And now everyone is worried. Oh, why is it that I'm beyond my date? What will happen to the baby? Sometimes that's the reason why some women take. So long as your baby is okay, your doctor has examined you, they will advise you when they want that labor to come. And we will prefer using something that we can predict. We know the dose, we know how to use it, we know the side effect, and we know how to manage it. Yes.
Alafu, we find it, most women tend to have worries na when maybe the doctor alisema this and this date, you'll be ready for that, then it skips.
Yes.
So you find them getting so worried.
Yes.
Sometimes hata wana panic. They want to be the doctor. Now you have to. It was written like this. This was said to me. What can you advise women?
Even the doctor is worried. If your dates go beyond. Let's say if you're supposed to deliver, your expected date of delivery is today. It means you've reached 40 weeks. You're not supposed to go beyond 42 weeks. But when you reach 41 weeks, actually many of us gynecologists, we don't wait for 41 weeks. Because the danger usually is that placenta becomes old. And now it does not supply blood as it should compared to a pregnancy that is young. So that might affect the baby. Number 2, the more you wait, the more the weight of the baby increases. And the more the weight increases, the more the labor is difficult. And you might get more complications.
Wow.
So we usually advise when you get just before 41 weeks, we do a scan and see what is the weight of the baby. Is the mother okay? Then we advise induction. So the worry in the mothers is justified. You should be worried when it gets past your dates. But so long as you're getting the baby kicks, the movements are okay, the water has not leaked, there's no much discharge, then you can wait until when the doctor will advise you and you do what we call induction. Because there's a point we can't go beyond. You don't wait for the problem to happen. You prevent before the problem happens. Yes.
Okay. Almost winding up. Does long use of diapers on girls cause infertility later?
Does long use of diapers cause infertility later? I don't know. That's a straight answer. No. Not one that I've heard of or read about. Yes.
Misconceptions. Huh?
Misconception.
And still on the same, about hygiene now. How often should the child be changed? Is it okay for them to... Sometimes I remember you were told, acha mtoto akae hivo for some time.
Now, if you're at home and you know the diapers is more of trying to have a clean environment, so the baby doesn't poop on the bed sheet, doesn't poop on themselves. If it was possible, the ideal would be you can leave them like that. But of course, when they pass urine, they might get some burns on the thighs. So you put the diapers so that it can suck there. But you see, when it stays for long, some children also end up getting rashes. And even the urine which is in the diapers can affect their skin and also the private parts. So we should advise you check frequently. If it gets wet, you remove. But not necessarily when it gets wet. If it takes long, not more than 6 hours, someone has a diapers because there is sweat. So you change as well. But if you're at home, unazacha aeration. Yes.
Okay, still on the same now.
But also depends what kind of diapers you're using. Because there are different diapers in the markets. Yes.
Yeah. Still on the same,
yes.
On hygiene. On our last episode, we talked about the discharge and the vaginal hygiene.
Yes.
When it comes to the use of sanitary towels, how often should one change? What is best? Sometimes at a site tunaambiwa the pads that we are told they're cotton, they're not 100% cotton. So how do we keep it healthy still?
That is another area that is not well understood. Because we have different companies making different kinds of pads, using different kinds of chemicals to preserve the same. Some are scented. Now, what we shall advise, whatever pad you're using, after 4 hours, you remove 3 to 4 hours, even if it's not fully soaked. Because, different people, their flow is different, their menstrual flow. So there are some who will wait until imesoak kabisa.
Wajua inakuwa imeandikwa up to 8 hours.
Up to 8. No, we advise 4 hours you remove. Maximum you can go maybe 6 hours. If you're 8 hours is quite long. And you know that the blood that comes out during the period, we say it's a good culture medium for bacteria because it's blood. So you might increase risk of infection if you stay with it for long. 8 hours is long. It's quite long. You don't want to stay with the pad for 8 hours.
For 8 hours.
Yes. Yeah. At least for maximum 6 hours, you change the pads, whether it's fully soaked or it's just some bits of stains.
Okay.
Yes.
And on our last episode, Kuliwaka Moto,
yes,
there's this question that has been asked severally. We talked about the vaginal health, and you said saliva carry bacteria.
Yes.
And now the question is oral sex healthy?
It's enjoyable. But what we usually advise is, you know the mouth. This is now the science. There's the science and there's the social part of it, the enjoyment part of it. Now the science is, the mouth, the way the vagina has its normal flora, normal bacteria for the vagina. The mouth also has its bacteria and everything. And from morning to evening, you put everything in the mouth. That's why you brush your teeth in the morning and you brush your teeth in the evening. So when you use saliva for lubrication, it's like you're transferring the normal bacteria of the mouth to the normal environment of the vagina. So that normal bacteria of the mouth or the flora of the mouth is not normal on the vagina. So you can actually increase the risk of infection. Yes.
Wow. And now you know.
So you should have ways of reducing that is just have good oral hygiene. Like brush your teeth in the morning, after lunch, after dinner, so that by the time it's action time, your mouth is clean. But if possible, avoid using the saliva for lubrication. Yes.
You've had, and daktari, ni kama tumemaliza maswali.
Najua hapo nimeguza live wire. Yes, but that is the science. That is the science behind it. Yes.
Wow.
And we have lubricants that are sold. Yes. And if friction is a problem, if lubrication is a problem, saliva is not the best lubricant. We have many lubricants that are available in the chemist. It might be easily accessible. Hakuna kusonga. But we have lubricants that can be used for that.
Okay.
Yes.
One last one now.
Yes.
For a new mom, how long should it take before they menstruate?
For someone who's breastfeeding. Now, after delivery, when the baby is breastfeeding, that process of breastfeeding, the more you breastfeed during the day, during the night, the more your periods will take long to come back. Yes. We shall advise you do exclusive breastfeeding in the first 6 months. Meaning you breastfeed only, no food, no water, no nothing for the baby. Just breastfeeding. So you might take long before your periods come. That is very normal. Then after 6 months, you might start mixing. You give food, you give water. So it means you've reduced the rates at which you're breastfeeding. So that's when most women, their periods will come back. Up to 1 year is okay if you're still breastfeeding. But if you've reduced the frequency of breastfeeding and you go past 1 year, 1.5 years, and you're concerned, you can come and we check why your periods have not resumed. So you should not be worried. You've taken a year, you're still breastfeeding, you've not had your periods. You should not be worried. It's very normal.
It's always nice learning and having fun.
Yes.
Thank you so much for coming.
Karibu sana.
Thank you so much for educating us. Hapa na pale tumetoa kaujinga fulani. Lack of a better word. It's been your host, Lea Ngure, and this section is Ask Your Gyno. Follow us on all our social media platforms. See you. Daktari, last words.
We love you. We love your questions. Send any questions, any worries that you have, any doubts. We will try and answer it to the best of our knowledge.
Yes.
And if you have any more questions, you can reach us. Our contacts are shared through our social media pages. We will get back to you sometimes privately because we don't want to share with everyone your questions and your answers. And we welcome you to our clinic. We are based in town at Jubilee Building. The clinic is called Modern Gyno Clinic. Karibuni sana. Kwaheri.
See you then.